All right, my name is Ben Gibbins. I'm doing something a little bit different. I put out a question as to what somebody would like me to talk about, what topics to talk about. The very first question is by Tammy, and she had asked about the topic of affordable health care. So before I even go into it, I want to at least have you consider that it's a highly sensitive topic, it's a highly complicated topic. So for anybody to just, answer it with a bumper sticker, probably doesn't know what they're talking about. And so how I'm going to answer this is my belief on the topic, what I believe the federal government's involvement should be, the state government involvement should be, community, and then our individual responsibility. So the first thing, my belief is that if anybody needs medical care, they ought to be able to get it. I mean, any human that needs it, they should get it. I don't want to confuse that with socialism. That's not what I mean. What I am saying is, because there is a fail-safe in law right now that no hospital can turn away somebody in need. So that's already there. But what about the individual that's that's working, or they're trying to get the health care that they need and they can't afford it? So let's talk about the federal government. It's my personal belief that the federal government needs to stay out of social programs altogether. What a government is supposed to do is oversight. And if we're talking at the federal level, they're responsible to uphold the standards of the Constitution and make sure nobody's civil rights or liberties are trampled on. So what they're doing in medical coverage, I have no idea. And here's one major reason why they need to stay out of it. They're not any good at it. And who's going to oversight the program if they're at the federal level? All right, so now the state's responsibility to us is to understand the situations that specifically affect our districts or our different areas. But they also need to stay out of social programs because they're also not very good at it. If you want your money misused, go ahead and give it to the government. It'll be misused somehow because the money's not transparent. We don't know where the money's going. But what they should be doing is setting standards and oversight of those standards for medical care. So what could be done at the state level and at the federal level is soliciting for insurance companies to come on board and to come up with ideas that's going to create large enough pools where there's going to be a group of folks that are generally not going to get sick with folks that are sick, and it offsets the cost. It brings the cost down for everybody. It's just how insurance works. But medical insurance is kind of unique versus like car insurance. There's plenty of people who have car insurance that will never get into an accident. So that offsets the cost. Problem with health care, if you're human, you need a doctor. You're going to see one at some point, I promise you. So how do we offset that cost? Well, I think one way in the individual, the community, and the insurances can come together on this is creating the insurance is creating a program with a large pool of people, and then there being a requirement for preventive medicine. Obviously, if a person doesn't need a treatment or doesn't get to the point where their scenario is acute, then the cost of a medical service goes down. Okay, and I'm not saying writing a law that says insurance company, you will do this. That's not what I'm imposing, and that's not what I'm suggesting. What I am suggesting is talking to the insurance companies, just straightforward language. Okay, look, what pool of people, how many people do you need in order to get your cost down? Because I do have an example of an administrator at one of the colleges that's paying over $2,000 a month for medical insurance, and I don't know how people do that. Quite frankly, when I was growing up, both my parents worked for the post office. They've since retired, but we had Kaiser, and I think the copay was nominal. And then when I was 17, I joined the Army, so all my medical coverage was taken care of. So I couldn't imagine adding a $24,000 bill a year, and then trying to find a way to put food on the table. It's just not going to happen. Obviously, I wouldn't pay the $24,000, and I wouldn't seek medical care, and then something bad could happen, and now I have to have medical care, and then financially I'd be in ruin. I also don't understand the connection between the workplace and requiring the workplace to have some type of medical care. I don't get why that happens. It's my belief that an employer has enough things on their plate that it shouldn't be forced on them. I do think it's a great idea for some employers to use medical coverage as a kind of a recruiting tool. They say, you know, if we hire you full-time, we'll also add this benefit or that benefit to your hiring package. I think that's a great recruiting tool. But to tell an employer you will give coverage once a person works so many hours a week, now we see what exactly happens is people, instead of working 40 hours a week, are now working 38. So, you know, the employer doesn't get the benefit of the employee doesn't get the benefits that are there, and that's why the federal government needs to stay the hell out of it, okay, because they're not any good at it. So let's separate the responsibility from the employer. Now it's our responsibility. This is something that we need. So as a representative of the state, I believe it would be my responsibility to reach out to nonprofit organizations, to those folks that are willing, those folks that have the means to support required medical care, such as preventive medicine and things of that area. So those ideas, that's not a tomorrow fix. That's something that would take time to develop and grow into something bigger. Okay, so if we looked at direct cost, how could we do this right now? Then bottom line, we'd have to find an insurance company who'd be willing to insure a large pool of people, which would then decrease the cost. So that would be, you know, in concert with the state, with the city, with federal, looking for these companies to do that. So how else could we reduce cost? So the cost, you know, to go to the hospital, first you have a facility. So one thing that the state could do, or one thing that the federal can do, is offer tax incentives. You know, if you're a hospital, it's to me, in my opinion, it's a utility. It's something that everybody needs. So there should be benefits given to a hospital because of the service that are given to bring down the cost of the facility. Also, now I don't really want to mess with staff. That's probably the one of the more expensive areas, because you know, you're talking about administrative staff, the nurses, the doctors, the specialists, and all that stuff. But those folks have gone to school for a long time to do what they do. In my opinion, they don't get paid enough. So I wouldn't even touch that topic. But here's some other areas. We're talking about equipment, supplies, medicine, and treatment. And to be fair, the reality is I would recommend doing a committee with professionals in the medical field to talk about anything that I haven't thought about. But negotiating prices on equipment, not trying to decide what equipment is necessary, not at the state level. The medical professionals should know what equipment is necessary, but the state doing whatever they can to negotiate prices down for them, because it's a utility. Same with supplies. To me, there's no reason why some of the supplies are as expensive as they are. But I don't produce the product. Bottom line, whatever supply is put in the hospital, it ought to be high quality. We're talking about human life. And then medication seems to be all over the place. It seems to be kind of in the Wild West, where prices just go all over the place. So my recommendation on that is just, if we are so hell-bent on making a profit on medication, then what the state and the federal can do is solicit whoever sells like medication to negotiate those prices down, and in the attempt that the market will then right itself, because some of the prices are inflated, bottom line. So if we were able to purchase medications from different locations that are at a lower price but it's still as effective, it brings the overall price down. And then as far as treatment is concerned, having treatment that is evidence-based, making sure that we're doing the best practice for the individual that needs the treatment. So if you notice, there's a whole bunch of domains when we're talking about the price of medication, or price of healthcare. And it spans all kinds of different specialties. So to have an honest conversation, I would need to have a conversation with specialists in all the fields, along with insurance companies, to find some happy medium, because there's no way that somebody should be paying $24,000 a year and expect to be able to survive. Because if I were to tell some of you, okay, we're going to add $24,000 to your debt, to your individual debt, in order for you to see a doctor, you're going to say, no way, that's not going to happen. So to summarize what I'm talking about, what I think needs to happen, federal government, bottom line, needs to stay out of social programs and needs to oversight social programs. They need to reach out and negotiate prices down for anything that I consider is a utility, a needed thing for all of us. The states need to identify what the specific needs are in their particular area and how we can combine those needs with the insurance companies to decrease those costs. The communities and the individual, I recommend that you do preventive medication, get preventative health care. Learn how to live healthier. So hopefully that combats any acute problem. Last thing I want is for anybody to get sick. And if there's something that the individual can do to mitigate that risk, that obviously brings down the cost for everybody, because that's not an expensive treatment that you have to do. And then going back to just recapping on the equipment, the supplies, medication, and treatment, using the best practices, equipment that is required for the job, but at the state and federal level, negotiating prices down because it's a need. And the federal government and the state government has the power to influence that, and they should, because it affects all of us. So I don't know if I answered everything, but those are some ideas. So bottom line, committee with professionals, negotiating prices down, creating a mixture of a pool for insurance companies, and preventive medicine, and get the federal and state out of social programs. So I hope that answers your question. Thank you for your time. And again, my name is Ben Gibbins. I'm running for State Assembly District 52. Please investigate me. Please check out my website at bengibbons.com. If you want to have a political debate on my Twitter, you're more than welcome to jump on there. It is PARA82ND_1. So that's at para82nd_1. If you want to send me an email, that's bengibbons@bengibbons.com. So again, thank you for your time. I wish you all the best, you and yours the best, and I'll talk to you again.